of days. Now, the doctor is in this morning to discuss why we should get a good amount of sleep each night. Good morning, Dr. VJ.
Morning.
8 hours, is that a good number?
You know, for the average person, it really is. 8.5, anywhere between 7.5 to 9 is how much sleep the average human being requires. Of course, this varies by age. The very young sleep a whole lot more. And really, as we get much older, we still continue to need about the same amount of sleep we required when we're in our adolescence and 20s, but it gets more difficult to get those out.
How do we know how much sleep we actually need?
You know, when you wake up in the morning refreshed and not tired, that's really the most important thing, because it's hard to judge and set it by alarm, because the amount of sleep you require also is dependent a little bit upon your activities the previous day, how much sleep you got the previous day. For example, to a certain extent, if you have 1 or 2 nights where you're only able to get a diminished amount of sleep, then you can sleep a little bit more the next day and kind of pay back the sleep debt, if you will. But if this persists for a long period of time, then there can be significant health repercussions.
Wow. Is it possible to train ourselves to get less sleep?
Not so much, not so much. Certainly we can train ourselves to function while we're tired. That's really what you're doing. When you set the alarm and you sleep late and wake up early over and over again for many weeks to months, you're training your body to function when you're very tired. And as we know, just like anything else, if you try to function when you're not at the optimal state, then there's a higher likelihood of things happening, such as illnesses. You're more prone to getting illnesses, certainly more prone to getting injuries. And many people say that intellectually you don't function at your best.
Wow. What about more sleep? Is more sleep better?
No, not really, not really. The only time more sleep is better is when you have a sleep debt that you're trying to pay off. So the most important thing is listen to your body. If you're tired, sleep in a little bit. But when you wake up and you're refreshed, then certainly get out of bed and get moving.
What about medications? Would you recommend any kind of sleep aid or medications to keep you alert?
Now, in general, both of those things one needs to be very careful about. Most of the medications for sleep aids and medications to keep you alert are actually risking that you can develop addictions to both of these medications. And neither of these allow you to function optimally. So unless it's for a very short-term, unusual circumstance and under the close monitoring of a physician, it's very important not to indulge in these. Of course, if you're a family physician or your doctor prescribes these for you, then it's okay.
Thank you so much for joining us this morning. And remember, Dr. VJ is here Sunday to answer all of your medical questions. So if you have a topic you would like us to discuss in the future, shoot us an email at news@KRRI.